Hi, everyone. Welcome again to another live Q&A with our Winona doctors. This is one of the best events that we get to do. So I'm so excited to be here with you all and so excited to have two of our amazing Winona doctors here with us. Go ahead. We're going to start answering some questions in a minute. So go ahead and drop those in the chat box. You can start doing that now and we'll get to them in just a moment. But if you want to, I'll let our doctors go ahead and introduce themselves real quick, and then we'll jump into it.
Okay. I'm Saren Perman. I'm a family medicine physician. I'm based out of Augusta, Georgia. And I've been with Winona for almost a year.
Nice.
That's awesome.
Ish.
So my name is Mike Green. I am an OB-GYN, and I also happen to be the Chief Medical Officer of Winona, and super excited to answer your questions. I actually am also a family doctor. I did a family practice residency way back in the day, and then I realized that I don't really like taking care of sick people, and I fell in love with women's health, and I wanted to deliver babies, so I did a whole second residency and did OB-GYN. And of course, my wife is thrilled about that.
Yeah.
What's that?
I don't recommend that.
No, I don't recommend it either. But honestly, it served me well because I have a bigger fund of knowledge than I would otherwise. So education is never a bad thing, even though I went a little overboard. I even have a master's in chemistry, so I took a few.
I would say
sideways moves.
I would say there's no such thing as going too overboard on the education. So I'm sure that everyone really appreciates that as well.
My student debt may disagree with you.
That's definitely a different angle for sure. That makes sense. Definitely.
So anyway, we're really happy to have you here. I see people are doing this already, but please put your questions in the chat. Otherwise, you just get to hear more about. I'll tell you about my thesis project when I worked on organometallic chemistry, which. No, I'm kidding.
That's not what we're here for. I was so excited for that.
That's not what we're here for.
So I usually like to do a little monologue just to let some questions get in there. I just want to talk briefly about one of the products that we have that I think is really underutilized. Probably it's our fault. We probably don't kind of talk about it enough. And that is vaginal estrogen cream. So we have a compounded vaginal estrogen cream. It's bioidentical estrogen in a cream form that is used topically in the vagina. And one of the big advantages of this is that it works really, really well for vaginal and bladder symptoms. So dryness, pain with intercourse, bladder leaking, urgency, all those kind of below the belt complaints of the menopause transition. This works extremely well, better than anything really. It doesn't really get absorbed into your system, which is sort of good and bad, which it means that it's like super safe. But on the other hand, it's not going to help really your other symptoms. It's not going to help your hot flashes and your sleep problems and your brain fog and that kind of stuff. So we add this on to your other HRT, but really in combination, it's a really, really great combination. So if you're having vaginal symptoms, you're a little frustrated because the systemic HRT, the cream, the body cream and the patch and the pill do help with the vaginal and the bladder symptoms. And sometimes it's enough for people, but if it's not, talk to your doctor about adding the vaginal estrogen cream. It's really it's a great combination. It really helps people. So anyway, it's something that we don't talk much about, and some people don't really realize it's there, but it can be very, very helpful. So hopefully, did I stall enough? We got enough questions?
We've got lots of questions. And I was going to say, I think that's one thing too that, I love about Winona, but I think lots of patients love about Winona too is, that we create room to ask the questions like that sometimes aren't as much talked about. So I love that you just said a little bit about that. I think that's so helpful for people to know and learn about for sure. But yes, we have lots of questions going on. It looks like we've got some good ones this time. So we can just jump right into those if you all are ready.
Let's do it.
Alrighty, awesome. Well, we'll start with Roni. Roni says, hi, I had a partial hysterectomy and my doctor recently recommended I use an estrogen patch. I asked if I should be on the progesterone and he said no because that's used to protect the uterus And since I no longer have one, I don't need it. Is that true? Do I not need progesterone as well?
That is correct. You were told the correct statement. So, as your doctor told you, progesterone protects the uterine lining from unopposed estrogen, which can cause the lining to get thicker. And over time, if the lining of the uterus gets too thick, that can increase your risk of uterine cancer. So we use progesterone specifically for that. You can take progesterone if you don't have a uterus, but you don't particularly need it. So you were given correct information.
Perfect.
And I'm going to add on that, because this is something that people get wrong. So in the big studies, when they look at it, estrogen by itself, so for people like you that have had hysterectomies that only take estrogen, do not have an increased risk of breast cancer from their HRT. When you combine estrogen and progesterone, there's a slight increased risk. It's actually pretty small, but it is a slight increased risk. So it's the progesterone, not the estrogen, that increases the risk of breast cancer. So I would say that probably over 90% of people surveyed would probably get that wrong, including doctors. But that's what the data says. I was actually surprised on the first study that came out that said that. I'm like, that's got to be wrong. Like, I need to see more data. And then another giant study came out that said the same thing. I'm like, oh, I guess it's right. How weird. So there you have it. So really, if you can avoid the progesterone, you're better off. And there's no point taking a medication that you don't need. So yeah, it sounds like your doctor's really on top of things. That's great.
That's great. It's always good to know that our doctors are taking care of us, for sure. Our next question, I see a question like this a lot in WWG, our Winona Women's Group as well. So it's great to see this here too. Shannon is asking, how long does it take to start seeing the weight drop off after starting HRT?
Well, everyone is different, but I would say this is probably the thing that takes the longest based on what we see with patients. Maybe 3 to 6 months, maybe even longer. It's definitely not a magic bullet. And for a lot of patients, when they come back for their 3-month follow-up, they say, my hot flushes are better, my night sweats are better, I'm sleeping better, but I still haven't lost much weight. So it really is one of the things, that and hair loss, that take the longest to really start seeing the changes and seeing the increased muscle mass and decreased fat distribution. So 6 to 12 months, I'll say. What do you say, Dr. Green?
Yeah, I mean, I think usually in that second quarter, somewhere in the 3 to 6 months, you start seeing some movement. But
just trying to lower expectations.
No, but you're right. I mean, for some people it takes longer, and really, this is not a GLP-1 medication. The weight's not going to fall off of you, but it does help with the weight gain that's associated with the menopause transition. But if you're like me and you've been struggling with your weight all your life, this isn't going to reverse that. But if you've been thin all your life and all of a sudden you hit the menopause transition and boom, all of a sudden the weight's sticking, this should help a lot.
That's a great answer on that one. For our next one, we have one from Sonia, and Sonia says, I'm a week in on the cream and I'm still having extreme hot flashes during the day. What else can I do?
It takes a while for your body to adjust to the hormone replacement therapy. So it may be, 4 to 6 weeks before you even start to see some improvements. And then, closer to that 8-week mark before you feel a lot better. So be patient and, hopefully if you aren't having side effects, you can continue and try and get to that 2-month mark where you should start feeling better. And if you're not at that point, then you and your doctor can discuss adjusting the doses.
Absolutely. We have a question from Felicia, and Felicia says, I'm researching HRT, and does one need to be tested with blood samples or anything else before taking it? It's high or low risk, and testing after 6 to 8 weeks after starting. What about that?
Well, that's a good question. I think that may be one of our most common questions that we get. You do not have to do blood work before starting HRT, and the blood work is not very helpful or reliable because it fluctuates so much. So if you're in the age range for menopause and you're having menopause type symptoms, if your menstrual cycles are starting to be more spaced out or more irregular, if you're having hot flashes, night sweats, all of those things, then it's worth, filling out a intake form, and one of your Winona doctors can also see if your symptoms match up with the menopause transition.
Absolutely.
I'm going to jump on this as well because it's such an important question. I'm going to be even stronger. Tests for hormones are useless. Seriously. There's absolutely almost no indication to do testing for hormone levels. They're really not useful. There's two reasons that people get hormone testing, that doctors order them. I think the vast majority is just they don't know better. It seems like, they get the lab, so they look at the Quest lab slip, and it's like, oh, I can test estrogen levels. Okay. Oh, look at that. They have this panel with estrogen and progesterone and LH and FSH. Oh, I'll just grab that panel. And it's easy, and it seems like the right thing to do. The problem is that the numbers are not meaningful because they bounce around all the time, like not just day to day, but even throughout the day. And so people have tried to devise other things knowing this is true. There's this so-called Dutch test, which is this fancy urine test where they collect urine samples all the time and do that, and that doesn't work either. So I think I like to give people the benefit of the doubt. I think the vast majority of people order tests because they think they're doing the right thing, but they really aren't. Unfortunately, there's also a few people that order tests because they're lucrative. And unfortunately, that's something that we fight in medicine. The lab industry has become a $1 billion industry. I don't know about you guys. I get emails from Quest all the time offering me lab tests. It's like, when did that start happening? Like, it's not even a doctor. It's the lab wants me to do lab tests. Ooh, in fact, I just got today I got a Black Friday special at Quest. It's like, that's a weird one. And because there's a lot of money to be made in lab tests, and some places do their own lab tests. They can order these lab tests and they can charge you to look at them for you. And so it's a bit of a racket. I think it's not the majority. I think that's the vast minority of situations, but it unfortunately happens. It's just really no reason to do lab tests. It's not helpful. And then the other part is that we get a lot of patients at Winona that are really suffering from symptoms of menopause transition, and they go to their doctor, and their doctor, well-meaning, orders lab tests, and lab tests all come back normal, and the doctor says, oh, this isn't your hormones. Well, it is your hormones, actually, and they eventually find their way to us. We get them on hormone replacement therapy, and it solves their problem, and they feel great. And it's like, wow, it's too bad that, because somebody didn't really understand the subtleties of this, that they trusted tests that weren't accurate, and because of that, you got dismissed, and you didn't get the treatment you need. So it's one of my big things, this whole lab test thing, because I think it really hurts women, both financially, but also it denies them treatment that they need. And again, I think it's well-meaning people for the most part. There's always a few bad eggs that are just trying to make money off you, but I think for the most part, it's well-meaning people that just don't know better. But there's just no reason to get lab work.
Absolutely. That's a great answer. Thank you both for going so into depth on that. I think that was really appreciated. We have a question next from Beth within the Winona Women's Group. And she's wondering, can the patch be used if she's a daily lap swimmer?
Yes. That was an easy one. But yes, even if you sweat a lot, even if you swim, it stays on pretty well. So we haven't had a lot of patients. In general, patients don't complain too much about having issues with the patch sticking.
Even in Augusta, Georgia, huh?
Even in Augusta, Georgia, where we just sweat all day, every day, people do okay with the patch.
There you go. There you go. We have another question, a little bit similar to one that we had about the weight gain, a little bit different angle. It's Leanie is wondering, how can she attack the huge weight gain? So I know we touched a little bit on this, but maybe you all can give a little bit more insight around what that looks like with Winona.
Certainly the estrogen and progesterone help with the redistribution and increase in fat versus muscle as you're going through menopause. DHEA is also helpful. That is something that converts into testosterone and can help with the weight gain. For a lot of patients, the HRT itself, as Dr. Green said, is not going to cause, help with large amounts of weight gain. So if it's 5 to 10 pounds that you've gained over the menopause transition, then it might help. But, if you're looking to lose 40, 50 or more pounds, then something like a GLP-1 agonist like semaglutide or Tirzepatide can be very helpful in addition to HRT to help with the weight loss and decreasing fat and increasing muscle mass. But I personally think that this is like the most frustrating thing for patients, the thing that they complain about the most. The hot flashes, usually we get those under control pretty fast. To wait, and most people probably feel this way. The weight is, I think, one of the most difficult things. And in life, the weight is one of the most difficult things too. So, story of my life too. But we see a lot of benefit with the GLP-1 agonists and HRT, just getting things back in balance. And certainly having your thyroid checked. You don't need to do that every month or two, but, every year, having your thyroid checked to make sure that that is still functioning properly, making sure you're getting enough sleep. Sleep is very, very important for weight gain. So that's one of those vicious cycles with menopause where you aren't sleeping well. And then, you're probably not exercising as much if you're tired, but sleep in general helps a lot with weight loss. So if you're not getting 7 to 8 hours of good solid sleep a night, then that in itself will affect weight.
And
I like to say it's like reversing a train, a speeding train. First, you got to stop the forward progress, and that's hard, and it takes a while. And then once you finally stop the weight gain, then you got to start pushing on that train to get the weight loss. So it's a big process. And, I'll talk to patients and I'll be like, well, have you gained weight since you started this? Like, no, my weight gain stopped. I'm like, okay, well, you're like, really, that's a big deal, right?
That's big, yeah.
You were gaining all this weight, and now at least that's stopped. Now we got to start working on pushing it back the other way and changing the momentum, and that takes time.
Absolutely. And I know that we just were talking a little bit about your thyroid, and we do have a question a little bit related, which is, how does HRT affect Hashimoto's or hypothyroidism? And that's from Heather.
So HRT shouldn't affect the function of the thyroid. Some people have to have their dose adjusted a little bit once they start HRT. So it's good to have your lab work checked like 6 to 8 weeks, a couple months after you start HRT, but it doesn't play a role in the autoimmune function of the thyroid. So it shouldn't cause you to have Hashimoto's or change how your thyroid is functioning.
Absolutely. We have a question next from Chris. And Chris is wondering, what is the difference between the Winona pills versus the other Winona methods?
So we offer estrogen and progesterone in pill form. Those are everything we offer is bioidentical, but we offer estrogen tablets and progesterone capsules. And then another option for estrogen is the estrogen patch, which is changed every 3 to 4 days. And then we also offer a cream, which is either estrogen only, estrogen and progesterone, or progesterone only. And all of them work equally well. It's really just a preference of what is going to work for you and what you can maintain on a daily basis. For the patch, if you have a uterus, then you have to add progesterone pill or progesterone cream. So if you're somebody that is thinking you want the patch because you want to avoid a pill, then you have to think about maybe you want to do the cream, the combination cream, or maybe you want to do the patch with the progesterone cream. But all of them work equally well. So it's really just what you think you can remember and do every day that you won't say, oh, shoot, I forgot to take it again.
Absolutely.
Let me also point out that the pills and the patches are commercially available. So they come from Big Pharma, basically. The cream, we have our own compounding pharmacies with really really good compounding pharmacists. Our pharmacists are amazing. I've learned more from these guys than anyone. But anyway, so the cream we compound ourselves. So that does two things. Number one, it decreases the cost. And if you kind of like this, sort of sticks it to big pharma a little bit, which I kind of like. So the, you know, on the other hand, if you're looking for something that's manufactured in, you know, in a big pharmaceutical plant, then you might want to go with the pills or the patches. So that's a distinction as well. But if you're needing estrogen and progesterone, the combination cream is going to be the most economical for you. The pill is pretty close, and the patch is a lot more expensive, just quite honestly, because it costs us a lot more to buy it from wholesalers. Some people think, oh, the patch must be better because it's so expensive. It's like, no, it doesn't follow that way. It's just because the wholesale cost of the patch is so much more.
Absolutely. Awesome. Yeah, thank you both for going into that. And then we do have another question from Marie, and Marie says, aloha. Will this help with skin elasticity and low libido?
Short answer, yes. Long answer. Estrogen and progesterone will help with skin changes, skin dullness, those kind of things. DHEA specifically can help with libido. Again, that's one of those things that takes a couple of months. So you're not going to take a DHEA and then magically have your libido back. Winona also offers an estriol with tretinoin facial cream, which you can use along with the systemic treatment. And so that helps a lot with wrinkles and also elasticity and collagen in the face. Dr.
I'm going to jump on this.
I know you are. I can feel it.
You know what I'm going to say.
I'm all excited.
So my wife started our facial cream, and here's the thing: she was using tretinoin for a long time, but this combination of estriol and tretinoin, and we kind of looked around. I don't think anyone else is really doing this. Is really dynamite. So she started using the cream, and so she goes to this, her girls' night, which I'm always jealous because they're my friends too, but I don't get invited. But anyway, and she walks in, and everybody's like, "Oh my gosh, you had work done." It's like, no, she didn't have any work done. It was just the facial cream, and they didn't believe her. One of them actually wanted to feel her face to feel for pores. And then when she finally convinced them, they're like, "I want some of this cream." So this stuff works really well. And I can tell you, I'm your typical husband that doesn't notice anything. I've got I see the credit card bill. She got her hair done. So I remember to say, hey, your hair looks nice.
But this you actually notice.
I love that.
But I noticed, wow, your face looks, it's amazing. So yeah, I think it's a really, really good product.
Not that it wasn't amazing before.
It was already absolutely amazing. It's even more amazing.
More amazing. Don't get into trouble now.
But yeah, we took a long time to develop this and went through a lot of iterations before we found something we really liked. And we think we're really, really happy with this.
Mm-hmm. I love to hear that. That is also such a great story. That's so funny. I love that. And hearing all those sides of everything. We have another question from the Winona Women's Group. And they're asking not about the facial cream, but about the 50-50 cream. I've read that the cream is not as safe as the pills because progesterone is not absorbed properly in the skin. Is that true?
I would say actually the opposite. The topical estrogen is a bit safer than the pills in patch form or cream form. It has a lower risk of blood clots when it's absorbed transdermally through the skin. What was the other part of the question?
The progesterone issue.
Oh,
you want me to tackle that?
Yeah, you go. You do that one.
So here's the problem with the progesterone cream. Progesterone is really important to get enough of to protect your uterus. And if you mess it up, you can end up with some really bad problems with uterine hyperplasia or even a uterine cancer. So it's really, really important that it's done right. And obviously we recognize that. The problem is you can go on Amazon and buy a progesterone cream. That's over the counter, doesn't require a prescription. And if you look at the dose in there, there's almost no progesterone, which is why they're allowed to sell it that way. It's sort of progesterone in name only. And so there have been problems with people that have estrogen and they're buying this over-the-counter progesterone cream and they think they're protected because why not? They're using progesterone cream. And it turns out like you need enough progesterone to actually work, and that's not going to protect your uterus. And so there have been some bad problems with that. And so sort of the thing has come out, it's like progesterone in cream form isn't good, it doesn't work. And that's not true as long as it's done right. So you need to use something called micronized progesterone because it absorbs better. Progesterone is a big molecule, so it doesn't absorb through the skin as well as estrogen. And also you need to have a good enough dose, a big enough dose to work. And so we're extremely careful about that. In fact, almost overkill, because we don't want to have problems. Obviously, we don't want to. The last thing we want to do is hurt anybody. And we're a very conservative company. We would rather turn somebody away than risk hurting them. I mean, look, I get rid of your hot flashes, but I kill you. I haven't done you any favors, right? So that's something we're exceedingly careful about. We've had literally tens of thousands of patients on these medications, and we haven't seen any problems. There's really good data to support this, in peer-reviewed studies, but just from our experience, it's very clear that this is a very safe way to use the progesterone.
Absolutely. That's great. And next we have a question from Heather, switching gears a little bit, and she is wondering if she can go on HRT when she is postmenopausal.
Yes. We'd like to start HRT within 10 years of going through menopause, and before the age of 60. That's where you get the most benefit from reducing risk of heart disease, reducing risk of osteoporosis, helping with joint pain and all of those things. But as long as it's been within 10 years and she's before the age of 60, then the research shows that, yes, she can still start HRT.
Absolutely. And jumping off since we're talking about postmenopausal HRT, we have another patient, Sarah. She says she's newly postmenopausal and new to HRT. She's wondering if the 50-50 combo causes cramps similar to period cramps.
It definitely can, especially, and some patients get alarmed about some spotting or bleeding, especially they've gone through menopause and, oh my gosh, now they're having some bleeding again. That can happen when they first start the cream within the first couple weeks to month. And that usually resolves. We usually tell patients that if they're still having some spotting or bleeding or cramping that's going on after, 2 to 3 months, then they need to get in to see their in-person doctor and have an ultrasound and check out the uterus and make sure there's nothing else going on. But yes, it can definitely start cramping, similar to when you first start birth control pills or you have an IUD placed. The uterus is trying to figure out what's happening and why there are new hormones coming in.
Doesn't hurt like an IUD.
Yeah, it doesn't hurt like an IUD. Yeah.
No. And it really only should be at the very beginning of treatment. So it's not something you're going to have to put up with long term. But really the first month or two, maybe. Most people don't, but some people do. But it shouldn't be going on past that. So it's not like you're signing up for monthly cramping again. That should not happen.
We want to make you feel better.
That's good to hear. And kind of what you were just saying a little bit, Dr. Perman, we have a question also with the pill. And is there any problems with being on the pill for birth control and also doing HRT?
Such a good question. And your in-person doctor, especially if they're not trained in OB-GYN, might actually not know the answer to this. This is something that I learned post-training, not during family medicine residency. You can take birth control pills or IUD with HRT. The birth control pills have synthetic estrogen and progesterone that really are controlling ovulation and preventing pregnancy with estrogen, the estrogen birth control pills, estrogen and progesterone birth control pills. Whereas HRT is bioidentical estrogen and progesterone that's more mimicking what your body should be releasing from the ovaries. And should help with the menopausal symptoms. So you can take both, especially if you're trying to control your periods or preventing pregnancy. But we get asked that's probably like the number 2 question. Blood work and can I take my birth control pills?
I love it. We're just gonna go down the list of all the like most popular questions. I love that.
Well, I mean, it makes sense, and honestly, you may get a different answer from us than you get from your in-person doctor because, you know, especially if they're family medicine or internal medicine, they may just not have as much exposure to it. I did not get a lot of training in menopause health in residency, so I don't blame anybody who doesn't have the answer. It's just you have to know where to look, and menopause health has changed a lot over the last 10, 20, 30 years. So there's a lot of new information. So you may hear different things from different people, and hopefully you can, you know, get the most scientific answer from us.
Yeah, and I would say even your OB-GYN. Honestly, the OB-GYN generalist doesn't do a lot of menopause management. They deliver a lot of babies, they do a lot of birth control, they take people's uteruses out, they tie tubes, and then they do a little bit of menopause management. So it's not really what they necessarily specialize in. This is what we do all day long. We kind of live and breathe this. So we, you know, we stay up on the latest and greatest stuff and what's the newest research.
Okay, sorry, I just saw in the chat someone said, did you say that pills can cause more blood clots than cream? Not more blood clots, but the transdermal is less likely to cause blood clots. In terms, there's always a risk with estrogen that you're I just want to make sure that I didn't say it inaccurately. There's always a risk with estrogen that you can have blood clots. The transdermal, which is cream and patch, are less likely to cause blood clots, correct?
Yes, but also people
there,
they overestimate the risk. So the risk of blood clots, even with pills, is really small, much smaller than your birth control pill, much smaller. It's much smaller than getting pregnant. So it's really a very, very small risk. That risk is reduced a little bit with the transdermal. Some people, doctors included, get this wrong and they think, oh, well, if I use a patch and I don't use a pill, I don't have to worry at all about that. It's like, well, that's not true either. But the risk is really small. And so reducing a really small risk, you know, it's good, but it's still just reducing a really small risk. So most likely for the vast majority of people, pills are perfectly safe. And the patch and the cream is a little bit safer. But for most people, it's not enough of a difference to make it a huge difference. That's the other thing that raises people's eyebrows is, well, gee, you're already on estrogen and progesterone from your birth control pill, and now we're adding this estrogen and progesterone with HRT. Oh my gosh, we're like vastly increasing your risk. And it's not actually, because all of that risk is really taken from the birth control pill. The amount of extra risk from the HRT is really, really minimal. It's just not enough to be a big issue. But still, people have this sort of visceral reaction sometimes to it. People meaning doctors. And they're like, what? You're on both? You shouldn't be on both. It's like, no, it's okay.
Absolutely. And I know a little bit ago we were talking about the patches and lap swimming. We have another question about the estrogen patch from Felicia. And she's just wondering, are there any things that she should do or avoid while wearing it?
I don't think so.
I can't think of anything.
Well, great. Yeah. That's an easy answer.
Like a tattoo on top of the patch, maybe.
I like that.
Like
well, then it would be patch. That'd be good if you don't like the tattoo, you're going to change it in 3 days. So
you can just take it off.
Oh, that's true. That's true. Or like a flu shot in the patch.
Okay, right.
No needle.
No one's going to do that.
But really, no.
Yeah. Well, let me just say, the patch should not be cut in half. That's a mistake people make. So that's something you shouldn't do with the patch. So it's not like, well, I want a smaller dose, so I'm going to cut a little piece of it off. It's in this funny matrix, and cutting into that really affects the absorption, and it can throw off the absorption of the estrogen in the patch. So that's kind of a big no-no.
Absolutely. I think that's a great answer. And jumping over to Tara has a question. She is wondering, how does using estrogen and progesterone cream affect your cycle? I'm 39, a week in, and just wondering what kind of changes to expect.
You may have no changes at all, and it may throw off your period. You may have your period a couple of weeks late. You may have some spotting between periods at first, but then it should go back to however it was before you started the cream after a month or two.
Absolutely. We also have a question. I think this is one I see a lot in the Winona Women's Group as well, so I'd be interested to hear what you both have to say on this. But this question is from Julia, and she's wondering, can the cream rub off on your husband in bed?
The cream can rub off on your pets, on your children, on your spouse, but it should absorb in your skin within 30 minutes. So, internet connect. Oh, there you are. Okay. It should absorb in your skin within 30 minutes. So for patients that are concerned about it transferring to somebody else, sometimes we say to apply it to the inner thighs, if your kids are going to join you in bed. Dr. Green, you want to answer that one about spouse? I guess
so my wife uses a cream, and I'm not worried about it. Actually, she's switched, but she was using the cream for a long time, and I'm not worried about it. Again, it's completely absorbed within 30 minutes. And even if you touch the skin, I mean, you have to really go out of your way to get enough transferred. We've had a couple of patients over the years who have a dog that's a licker and like licks the stuff off. And
I have one of those.
Yeah, getting big nipples. And that, and I'm like, well, put on the inner thigh. If your dog's licking that up, we got a bigger problem we got to deal with. So that is an issue. So if you do have a pet that, wants to lick you as soon as you put something on, then you want to put it in a place that's not accessible, or maybe not use the cream. Because there have been a couple of dogs that have, basically what's happened is their breast tissue gets bigger. And, obviously you don't want to expose your pet to something. So, but that would be really the way it would happen. Or if, you put it on and then you start all over your dog, okay. Yeah.
Or your spouse.
Or your spouse. But yeah. So wait.
Now we say inner cream or thighs, but they can do it on their outer arm or really anywhere on the body below the.
You want to put it on a place with no hair follicles.
No hair.
So there are enzymes in the hair follicles that can metabolize the estrogen and the progesterone. So you really want to avoid not places you shave, places that actually don't have hair follicles. Mm-hmm. So that's why the inner arm, the inner thigh, the back of the knee, those are kind of the key places that you can put it that most people don't have any hair follicles.
Absolutely. And it looks like we have a question from Joanne, and she's wondering, are there any supplements you usually recommend in conjunction with 50/50, the 50/50 cream, and DHEA to assist with cortisol reduction? And then she says, and hopefully weight loss.
All of the main stuff that you would take for improved sleep and improved energy levels. So vitamin B12, vitamin D, those are the big ones. I'm not a big supplements person. I know we have a lot of patients that like supplements, but for me, basically multivitamin, vitamin D, B12, I don't see much more past that. That's super helpful.
Calcium, I'd throw calcium in there.
Calcium.
But otherwise, I agree. We don't have any supplements in our house.
Actually, I think if you ask most doctors, what supplements they take, the list is probably pretty short.
Yeah, some of you gals, like I see your list, it's like there's like 18, 20 things on the list. Like, man, how do you remember to take all that?
Yeah.
Like, it's like that's got to cost a fortune.
But whatever works.
No, right. There isn't anything you can't take supplement wise.
Yeah.
It's just there's pretty limited data on most of this stuff, and you end up making like really expensive urine.
There you go. Definitely. We have a question from Alex, who is just wondering, can you use Winona if you have regular periods but perimenopause symptoms?
Yes, definitely. And that's a hard one because you can be in perimenopause and still having periods once a month. So that's a tough one. And that's probably one where if you ask your in-person doctor and they're not menopause trained, they're probably going to say no. But yes, you can. And you can still get pregnant when you start HRT. So HRT is not a valid form of birth control. And if you're having periods once a month, you probably are still ovulating, at least some. So
even if you stop having periods, you never know when that one egg is going to jump out. So if you're under 50 and you haven't had a sterilization procedure, you need to worry about getting pregnant. And, I mean, that's the problem, is it can still happen, even if you don't think so. It's like there's just that one egg left up. And they like to jump out at the wrong time.
I will say that it seems like a lot of patients now are having IUDs placed. It's becoming very popular, especially for patients that are in perimenopause, but still could get pregnant. So we're seeing a lot of IUDs, and it seems like a really good long-term option for pregnancy prevention.
I would say also, the contraceptive implant Nexplanon is also, the two of them are, that's when I still see patients in my office, and now and then. I live in this little small town, and we have a little rural health center. And so I still see patients a couple half days a month just to be part of the community. But I always recommend what we call LARCs, long-acting reversible contraceptive devices, which is basically one of the IUDs or the contraceptive implant. It's really the best way for most people to do birth control. So it's something to think about.
Absolutely. And we have a question from Christine, and she's just wondering, do we prescribe testosterone?
We do not prescribe testosterone. It's a controlled substance, so that's not something that we can do online. We do prescribe DHEA, which is converted into testosterone and estrogen. And you can get DHEA over the counter, but ours is through our pharmacy, so we can tell you that it is safe and effective, and we know where it comes from.
Absolutely.
What else? Dr. Green, anything else? You wanted to say something?
Uh-oh. Yeah, I think I'm disconnecting. There we go. I'm back on.
You're back.
Can you hear me?
No worries. Yeah, you sound great.
We actually we don't compound our DHEA. We actually have it made for us. But the last order I heard we put in an order for 10 million units. So when you're ordering like that, you have absolute say in the quality of the DHEA. And we insist on testing before we accept it. Last year, we turned away 3 or 5 million unit order because it didn't meet the testing requirements. We're really picky about our DHEA because we only want to, like, hey, I'm responsible for your health. Well, I'm giving you something. I want to make sure it's right. So fortunately, we've grown, our company's grown big enough to be in a position that we can demand what we want when you're ordering that kind of volume. So we're very fortunate that way. So it's made specifically for us.
That's great. We have a question from Judith, and she says, I'm a week in, great results so far. Bye-bye hip pain at night. You aren't missed. I love that. But she says, but I still have zero libido. Do you think I need more time? Like, do I need to wait more time? Do I need to add something beyond the pill and the 50-50 cream? What are your thoughts on that?
Time. That's the hardest thing for us as doctors to prescribe, unfortunately, is a prescription for time. But if you're on the DHEA and the estrogen and progesterone cream, give it a couple months and you may need a higher dose of DHEA. Hopefully, as you're feeling better and sleeping better and your mood is better, those things also all are intangibles that help libido.
Absolutely.
And time.
I like that. That's a easy answer.
There's no prescription for time, but time usually tells you if something is going to get better or get worse.
Absolutely.
I want patience and I want it now.
Yes. Yeah. Exactly.
Exactly. We have a question from Kirsten, and she says she ordered the capsules for both estrogen and progesterone. Should she be concerned about it damaging her liver?
Okay, so the estrogen should be tablets, just making sure. Estrogen tablets, progesterone capsules. They are metabolized through the liver, but as long as you don't have any baseline liver issues, then that should be fine. If you have cirrhosis, then that probably wouldn't be a optimal choice for you. But the liver metabolizes all the medications that you take, for the most part, except for some that go through the kidneys. But the liver, if your liver is healthy, then your liver will do a very fine job of metabolizing medicines.
Absolutely. And we have a question from Danielle, and she says, my insomnia is worse than starting. I'm using 1 pump of the cream in the morning, but I still can't seem to turn my brain off at night. I'm 6 weeks in, I'm 51 and still in perimenopause.
So we usually recommend the cream at night because the progesterone often is helpful with sleep. And unless you're having side effects, 2 pumps is the effective dose. So unless your doctor told you to decrease to 1 pump because you were having side effects, but 2 pumps at bedtime works best for most people with sleep. I personally am a fan of melatonin, as long as it's just melatonin and not other stuff. He's in California, so I'm just, yeah. But melatonin, I think, does a really nice job at helping to fall asleep. The biggest trouble and the hardest thing, I think, for doctors is waking up in the middle of the night. It's hard to get back to sleep once you wake up in the middle of the night. So if we can control the hot flashes and bladder things and you don't wake up in the middle of the night, then as long as you're able to fall asleep, you should be good to go.
Absolutely. And it looks like...
What do you want to say?
Sorry, am I back on? My internet keeps dropping.
You're good. You're good.
Yeah. So, it's kind of funny. I like to cook, and you go on these sites to get recipes, and then people tell you, well, I changed this and I changed this recipe's terrible. I substituted this and I substituted that, and it tasted bad. It's like, we didn't try the recipe. So use 2 pumps and use it at night, and then I think it'll work.
That's what my mom does. She makes it sugar-free, and then it's disgusting.
Yeah. I mean, honestly, I don't do the recipe either, but then I don't complain that the guy's recipe is terrible.
She doesn't complain either, but I do.
Well, no, I like that. So I got a taste like, okay, this is what I want to make. And then I look at a bunch of recipes and figure out how to make that taste, and then play in the kitchen. That's kind of how I like to cook. It's like my creative outlet. Anyway, sorry, I digress.
Yeah, we did.
We have a question from Beth. She says, hi, thank you so much for doing this. She had stage 1 breast cancer and was cured in 2016, but she says that her gyno wouldn't prescribe HRT. She went to another doctor who resisted to prescribe HRT because her labs were normal, but she put her on 100 milligrams of oral progesterone and 0.025 estriol patch 2 times a week. I heard that's too low to make a difference. Your thoughts?
That's you. You're up.
Okay. We are a very conservative company. I already said that earlier. The nature of the way that we are able to practice healthcare, we have to sort of cherry pick a bit. And so we don't prescribe to women with a history of breast cancer, even though you've been cured, and thank goodness, good for you. Because, we really we can't talk to your oncologist. We can't get all those records. This is complicated. And this really requires a really kind of complicated, in-depth discussion that we can't really do in the type of telehealth that we do. And so again, in trying to be extremely safe and not hurt anybody, it's not something that we would prescribe on Winona. I think if you were going to use HRT, you want to use the absolute minimum amount. So I kind of agree with your doctor. I would start with the smallest dose, and the 0.025 patch is the smallest dose patch they make. And I would give that a real good trial before I would consider going up, because you really want to be on the minimum amount of hormones you can. Because again, the last thing you want is a recurrence of your cancer. But you're, unfortunately, with your history, you're not somebody that I think would really be appropriate for our platform. But I'm glad you've got a doctor that sounds like taking good care of you.
Definitely. Stephanie has a question where she is saying that she's suspecting that she has vaginal atrophy. how do she know whether she should increase her testosterone or add estrogen cream?
Testosterone's not going to help your atrophy very much. Testosterone is important for women in very small doses, but not so much for vaginal atrophy. That's not really where testosterone shines. Testosterone is good for energy. It's good for your libido. It's good for weight loss. It's good for maintaining muscle mass. Estrogen is what's going to help your vaginal atrophy. And as I said at the very beginning, you may not have been on yet, but the vaginal estrogen cream is the absolute best thing there is in the world for vaginal atrophy, for vaginal and bladder symptoms. And so if the regular estrogen that you're taking, either as a patch or a pill or a cream, isn't working well enough, then I would add a vaginal estrogen cream. But I think testosterone is the wrong answer.
Absolutely. And that is something that we talked about blood work a lot, but if you have a vaginal exam, your doctor will definitely be able to tell you whether you have vaginal atrophy or not, or you will be able to tell when you have your speculum exam.
Absolutely. And we have a question from Andrea, and she says that she's used testosterone pellets in the past, and about 5 weeks ago, she added the estrogen pellet and oral progesterone. She says she feels as if she's having really bad moodiness. Would the creams be a better option to use in this case?
I'm taking that one too. Sorry. That's one of my favorites. I hate pellets. So let me start with that.
I'm just going to mute
the
myself.
Pellets are, in my personal humble opinion, they're just a ridiculous way to do this. They're incredibly invasive. They're non-reversible, especially. So the big company that does these pellets is a company called BioT, and they really push these testosterone pellets. And the problem is the testosterone makes you feel great at first, and then the ugly side effects start rearing their head down the line. And so the first pellet, people, oh my God, I feel so great. And then the second pellet, they still feel pretty good. And by the third pellet, they're just miserable. And some of these side effects are really bad and potentially irreversible. Pellets are incredibly lucrative for your OB, and so for whoever's putting them in. So to me, the big indication for putting pellets in is to make your next car payment. Not a great indication for the patient. So I just don't understand why someone would get pellets. The cream, the patch, the pill, if you have a problem, you just stop them and the problem goes away. And you don't have to worry about this accidental overdose and ending up with these really bad, irreversible side effects that can happen. And we've had some patients come to us on pellets with like really bad problems. And they stop the pellet, we can help their symptoms, but some of those problems don't go away. So again, I have a big bias against the pellets. I know they're popular, but they're being pushed by the doctors because they're a really lucrative part of a practice. But I just don't understand medically why anyone would think they're superior to the more traditional methods of HRT.
Absolutely.
So yes, I think you should switch to the cream, whether it's ours or somebody else's.
I think that's a great answer. We have a question from Jody, and she says, my mother had uterine cancer and ultimately passed away from it. I've had a partial hysterectomy since then. Is HRT safe for me, and are there any products I should avoid? Oh, Dr. Perman, I think, yeah, there you go.
I know I muted myself when Dr. Green got really, really excited about the pellets. I just thought I would mute myself. So first of all, sorry to hear about your mother. And as long as you don't have any genetic hereditary syndromes that predispose you to cancers, then that should not be a problem. And since you've had a hysterectomy, that should not be an issue as well. So you should be able to take estrogen, HRT. Anything else, Dr. Green?
No, I think that's exactly it. I mean, you don't have a uterus, so you don't have to worry about uterine cancer. That's good.
Yeah.
Most uterine cancer is not hereditary. There are these strange birds. So if your mom had uterine cancer and your uncle had prostate cancer and your aunt had breast cancer, and it's like everybody seems to be get colon cancer, everybody seems to be getting cancers, then you might want to get genetic tested because there are these kind of rare things. My MA, she was my work wife for 14 years. And she kept going, she kept having to leave for funerals. And it's like, gee, I don't want to get close to you. Like everybody around you drops dead. And it turned out she had one of these rare genetic family problems where everybody was getting cancer. So fortunately we found out about it and we were able to do some stuff to help decrease her risk. But for the vast majority of people, uterine cancer is not passed down genetically. So you should be fine.
Jennifer has a question where she says, if DHEA breaks down into all necessary sex hormones, why not just start with DHEA and let the body break down into what it's deficient in?
That's not a bad option, especially if you're very early in perimenopause or your symptoms are mostly energy, weight, libido, and you're not having hot flashes. But if you're at the point where you're having hot flashes and night sweats and joint pain and mood swings, then DHEA is probably not going to convert into enough estrogen to make you feel better.
The contribution of estrogen from DHEA is really small. The truth is the amount of testosterone from DHEA is really small too, but women don't need very much testosterone, but they need a lot of estrogen. So the amount of DHEA you need to take to get your estrogen levels where you want them is going to give you way too much testosterone. And so it's not really a great approach. It's like in theory, hey, that sounds smart, but it actually doesn't work because it just doesn't give enough estrogen. And there's health benefits to estrogen that are important. It decreases your risk of cardiovascular disease, decreases your risk of osteoporosis, decreases your risk of colon cancer. There's all these really good things, but you need enough of it to do that. And DHEA is not going to provide that unless you go crazy with the dose, and then you're going to end up with testosterone side effects. So the balance isn't there, unfortunately. But it's a great idea. It's just in practice doesn't really work.
Absolutely. We have a question from Latina, and she says that she's 55. She's been postmenopausal for 2 years, and she just started taking HRT and DHEA on October 10th. She says that she's had some symptoms since then. She's been spotting about 9 days. And when she messaged her Winona doctor, she went down to 1 pump instead of 2, but has kind of seen the spotting continue and has felt that her neck has started swelling above her collarbones. She said that she went into her doctor who is going to order some, it says US neck and a CXR cancer marker blood work next week. She also says that her mom and sister have had breast cancer. She's wondering, does she need to stop HRT and DHEA?
That's you. You're up. We're not doing that.
So the first thing I would ask is there a genetic component to the breast cancer? So if you've got 2 first-degree family relatives, somebody should get tested for BRCA and some of the other genetic risk factors. And if those are positive, you probably want to stop the HRT. The spotting is annoying. It doesn't sound like it's dangerous. Not if it's just you've only been on it for a month, and that's pretty normal. So I'm not worried about that. The swelling is I'm not sure what that is. It's not a typical side effect of HRT unless you're just retaining a ton of water, but then you should be swelling elsewhere. So I think that's something probably different. But I think, I would talk, if your mom and your sister are still alive, I would definitely see if they got tested for one of the genetic markers for breast cancer. If they're negative, it kind of gets you off the hook. But if they're positive, you probably want to get tested as well. So I don't think at this point you need to immediately stop your HRT, but I would definitely keep working this up, especially I'm not really sure what's going on with your swollen neck. I don't think it's related to the HRT, but definitely something that needs to be kind of tracked down to figure it out.
What about the 1 pump of the cream?
Well, if that's what her doctor said, her doctor has more information than we do, so I'm not going to go against that.
Absolutely. Our next question is from April, and she's wondering if it's okay to take a GLP-1 with this medication, with Winona medication.
For sure, as long as you don't have any contraindications to GLP-1. So MEN2, pregnancy,
history of pancreatitis.
Yeah. There's not a ton of contraindications, but yes, we talked about this a bit at the beginning. They work super well together. The HRT is not going to help you lose a lot of weight, but it'll help reverse the train, as Dr. Green said. The GLP-1 will actually help you to get some weight off. Yes, they work great together, and most people do very, very well on GLP-1s. You may be able to, as your menopause symptoms improve, not need as high of a dose of your GLP-1 to help maintain your weight loss.
Absolutely. And it looks like next we have a question from Carla, and she says she's postmenopausal and she just started the cream last week. Before menopause, she had fibroids. Will the 50-50 cream cause them to regrow?
No. But if you have fibroids already, it's possible that you may have some bleeding from them. So that would be something to keep an eye on. But estrogen does not cause them to form or cause them to get bigger. If they're there, they're there. And Dr. Green will tell you that 30% of patients have fibroids, whether they know about it or not.
Yeah, something like that. You could just pull a bunch of random women off the street and do ultrasounds. You're going to find fibroids. The dose of estrogen in the HRT is not going to reactivate your fibroids, so you'll be fine.
Absolutely. We have a question from Lani, and she says weight gain and hair loss is the biggest issue for her. No kids, no pregnancies, only fibroids removal from a uterine scrape. Still have all her organs and ovaries. Would HRT be a solution for her?
It will help, but it will take a while. So we talked about weight and hair being the two things that take longer than the hot flashes and night sweats and the typical common things you hear about. If it's just hair loss itself, then HRT can help, but you might also want to consider oral minoxidil or topical minoxidil or spironolactone. There are things that are more focused specifically for hair loss. But HRT is very helpful for overall health and cardiovascular health and osteoporosis prevention. So it really depends specifically what you're looking for. But hair loss in general takes a while. So even if you take oral minoxidil, it's going to take, 3, 6, 12 months. So it takes a long time.
It has to do with the way the hair cycles. By the way, here's a little life pro tip that a lot of people don't know. The specialty that specializes in hair is actually dermatology. If you want to see a specialist about your hair, it's a dermatologist. So a lot of times people are surprised by that.
That is surprising. That's a good factoid to tell everyone. That's
the biggest organ in the body, right? The skin.
There you go. Yeah. We have a question from Rebecca. She says that her dose increased 3 weeks ago to 2 pumps per day in the evening. And since the increase, she's had bad nasal congestion about an hour after applying every night. She's found that decongestants haven't really helped at all, but she has no congestion during the day. Will this subside over time?
That's interesting. I haven't heard that one. Have you dealt with that?
No.
Yeah, that's an interesting side effect. So you'll have to tell us. I think it probably will, but yeah, it's not a typical side effect. But it's amazing. The human body is so varied, and everybody responds uniquely.
Very interesting. We have a question from Heather.
By the way, you might try an antihistamine rather than a decongestant, or a little Flonase could help as well.
Yeah,
definitely.
Or a neti pot, maybe like a Zyrtec and a neti pot.
Yeah.
We're in that season of the year, especially depending on where you are. In the southeast, we're doing our pollen season now. So
it's terrible here. We've had a huge bloom this year too. You should see all the pine cones on our pine trees. It's amazing, and there's acorns freaking everywhere. But that all is really tough on people's allergies.
We don't have any acorns on our yard because the trees are not there anymore.
Well, yeah, you had something come in and take care of that.
sorry to everybody who dealt with Hurricane Helene and Hurricane Milton and all the other hurricanes and fires and all the things.
Absolutely. Heather is wondering if Winona takes insurance.
We do not take insurance, but you can submit the receipts to your HSA and hopefully get reimbursed. Insurance usually will treat menopause treatment.
So yeah, you can even use your HSA FSA card. You can put that in as your primary card and bill it directly to your HSA FSA account. But yeah, we don't take insurance per se.
Absolutely.
But we have had patients get reimbursed by submitting to their insurance company, and we have some paperwork that you can use, although we don't fill out specific insurance paperwork.
We have a question from April who says she's had no period for a year, then a period for 1 month, then 9 months, no period again. She had a pap and blood work done, etc. And they said that she's just that she's not in menopause and no other answers. Is this normal?
Yes. So menopause means pausing of the menstrual cycle. So menopause is defined as a year, 12 months without a period, but you can have several years of some periods, no periods, a period, surprise, no period. So that can go on for a while and it can be very unpredictable. But yes, that is all very common. So, you can only say that you're truly in menopause once you've had no period for more than a year. So that can go on for a little while.
And even that is arbitrary just because we had to pick a number.
We had to pick something.
There isn't anything physiologic about 365 days. And you might still get a period at 366, sorry. But we have to make a definition somehow. So that's how we define it. You got to, be able to test the medical students somehow.
That's right.
There you go. We have a question from Marjani, and she says, how long is the cream good for once I use the first pump?
The cream has a 6-month shelf life. There'll be a expiration date on the bottle. It's 6 months from when they make it. We go through a lot of cream, so it's not like our cream is sitting in the storage for months at a time. So it'll be fresh, but there'll be an expiration date on the bottle. But it doesn't change when you open it. It's different than, say, a GLP-1 or a sterile injection where it may be good for 6 months in the bottle, but as soon as you stick a needle in it, it's good for a month. This is different. So using it doesn't accelerate the expiration date.
Well said.
Absolutely. Amy has a question and it's asking, can menopause worsen ADD or ADHD?
Yes, in that ADHD is probably worsened by sleep hygiene issues. So if you're not sleeping well, then your focus is probably not as good and you're having more brain fog. So whether it's ADHD or itself or symptoms that are similar to ADHD, then I would say yes.
Absolutely. Seb is wondering, and this was a question for a little while ago. She says, can Winona prescribe those things mentioned for weight gain? So I think that she's referring to GLP-1s or anything else on that end. So
a little advertisement, startwillow.com. Dr. Perman and I both work over there as well. So startwillow.com is another company that Winona's not associated, but Dr. Perman and I are. So if you want great doctors to prescribe your GLP-1s, you come see us over there. And if you tell us you're a Winona patient, we'll give you 50% off your first order. So
and they really are that good, GLP-1s. They really are like the cat's meow. Like they're so cool. They're so awesome.
I'll tell you what, go on YouTube and type in MedTwice. And you can see me 15 years ago. I look like a different person.
Type in what?
MedTwice. MEDTWICE. You don't know about MedTwice?
No, but I don't. That's okay.
That's okay.
I just know what you said.
Anyway, or you can see me early in the early Winona videos. You can see what I looked like before my GLP-1. So I've lost 46. I've lost 90% of my body weight. 46 pounds, and like it's crazy.
Crazy.
Oh, but you said 90% of your body.
19. No, that'll be a problem. 19.
That's really bad.
Yesterday, the owner of the gym thought I was juicing. I'm like, well, I am cheating, but I'm cheating with the GLP-1. It's like I had all this muscle, but you couldn't see it because it was hidden under all this fat. But now that the fat's gone, it's like, oh, you can see my muscles. So it looks like I'm juicing, but I'm not.
I was gonna say, YouTube's gonna get like a spike in people like running to their site with that. That's so funny. We have a question from Carissa next. And she says, incredibly, I'm overall improved. This happened in literally 2 weeks. Most noticeable is my energy and stamina better, libido increased. I'm on day 22 and started on November 1st. She said, I did notice a little bit of weight gain, but she's really optimistic that she can lose it. But she's wondering, how does this mix interfere? And you might need to help me on this one, but with a low dose of levothyroxine?
Levothyroxine, yeah, her thyroid medication.
There we go. Thyroid medicine.
Thank you.
So sometimes it's recommended to have TSH rechecked anytime you add a new medication, because sometimes it can mess with what dose you need. So normally it takes 6 to 8 weeks for your TSH to respond to a change in medication. So it probably, if you would like, it's probably reasonable to get a TSH checked after a couple months on HRT to see if you need a higher dose, but it doesn't affect the function of the thyroid or the autoimmune functions of the thyroid.
Yeah, the Synthroid and Levothyroxine, the thyroid replacement medications, are really finicky drugs. Like
Very.
Almost anything you do can affect them. So, and that's true of any medication, not just HRT. So you get started on new medication, you can throw your dose, you make you change your dose, but it takes a little while to find that out. It's a funny drug.
Absolutely. We have a question from Heather, and she says, if you take a GLP-1 medication, do you need to take it forever? She says, I already know that I have hypothyroidism.
Well, the GLP-1...
You're hitting our other love. It's so funny.
Yeah. GLP-1s haven't been around long enough to give you an official answer on that. But the common answer is it depends. You may need some amount of GLP-1 long-term to help with maintenance. Some people might not. It depends. If you're able to make all of the lifestyle changes and not go back to how you were eating before or metabolism before, then you might not. But probably most people need at least a small amount. Just think about, like, if you were to have a gastric bypass or a gastric sleeve, you're going to have that for the rest of your life. So if you're just taking a GLP-1 for a shorter period of time and then you take it away, your body's going to go back to how it was beforehand. But nobody can give you a official answer on that because they don't have super long-term, 20, 30-year research on it.
Well, I can tell you they can pry it away from my skinny dead hands because I'm not giving up my GLP-1. But I mean, I think it kind of depends, where you are and why you're taking it. Like if you're somebody who struggled with weight all your life, like me, I've been on every fad diet known to man, and I've been on most of the medication, and nothing works like GLP-1s do. And I know that if I stop my GLP-1, why wouldn't I just go back to what I've been the rest of my life? So I'm going to keep taking it. But there are other people.
Go ahead, sorry.
Yeah, there are other people that are in a different situation, and they just need to lose a little bit of weight, or something changed in their life, and so they just need to get back on track. And for those people, they may only need it for a short period of time, I think.
Yeah. But
you're right. It's been out now for about 8 years, mostly for diabetes. So we do have good, reasonable long-term data that it's safe. But it doesn't. And here's the other thing. People think, if I take a GLP-1 and I stop it, it's going to make me gain even more weight than I started. And that's not true either. It's just that the effect goes away when you stop taking the medicine. And so you would expect if the effect to go away, then things are going to go back to the way they were, but not worse.
Yeah.
And actually, the study, people only gained in a year about 2/3 of their weight. So they still got some of the benefit.
Yeah.
Sorry,
I was just going to say that, no, that's okay. The hypothalamic set point, the set point in your brain that kind of says what weight your body is supposed to be at, that takes a really long time to change. So, hopefully after you're on a GLP-1 for a longer period of time and you lose weight slowly and maintain it, then your brain can kind of adjust that set point. But that's why when people lose weight, over 3 to 6 months, say they lose 20, 30 pounds, they stop whatever they were doing, they go right back to where they were because that set point in the brain, in the hypothalamus doesn't change.
Absolutely.
Anyways, we digress as always.
And I'll tell you what, your body image. Just the other day, I walked by the mirror and I had a double. Like, oh, that's me. Like I forgot what I look like. So it is amazing how. What's that? You haven't had that problem?
No.
Oh, yeah, I like. Who's that? Oh, that's me. I forgot.
We have a question from Anna, and she's wondering, what are your thoughts on PMDD and HRT?
You want me to take that?
Yeah, sure. I was going to say, but yeah, go ahead.
Yeah, I think it can help for a lot of people. I've had some patients where we put them on HRT and things get better, but some of the PMDD symptoms are still coming around. Then what we'll do is I'll tell them to take an extra pump just during those bad days of the cream. And that tends to work really well. So there's little tricks we can do, again, to individualize the treatment for you, but it can be successful.
Absolutely. And we have a question from Tina, and she's wondering, can you take Tirzepatide with HRT? Does it make it one less effective? You might need to help me with that one too.
No, that's the GLP-1 Tirzepatide. Yes, we're all about the GLP-1s with the HRT.
I love seeing the trends. I think that show up, in every Q&A. I think it's so interesting.
Yeah.
There you go. We have a question from Katrina, and she's wondering, can she do one pump at night and one in the morning?
You can. It's not what most people do, but you can. Some patients take usually 2 pumps at night or 2 pumps in the morning. The people that use the cream in the morning oftentimes are the people where they find that the cream actually is more activating. Some people respond a little bit differently to the progesterone and they find it's more activating. So they use the cream in the morning. That's kind of how I feel about Sudafed. Like if I take Sudafed before I try and go to sleep, all bets are off. But most people do 2 pumps at a time, but you could split it up.
Sudafed's one methyl group away from amphetamine. So there you go.
Well, that gives me crazy dreams. So I have to be really, really stuffed up to have to take it at bedtime. Too much information.
Nicole is wondering, is there an effectiveness difference of the patch versus the cream?
No, not particularly.
All right.
The effectiveness is whether you're using it, if you're compliant with it. So if you have a lot of trouble remembering to use the cream every day, then it'll be less effective.
Absolutely. Angela is wondering, she says, I am taking oral DHEA capsules and oral tablets of estriol. There were no she said she couldn't find any directions as to when to take them. Do you know, will they make you sleepy? Will they keep you awake? When's the best time to take them?
Most patients take DHEA in the morning, especially because it can help some with energy levels. And most patients take estrogen at night, but everybody is different. So if you try that and it doesn't work, then you can play around with it a little bit.
Absolutely. And we have a question from Rose, and Rose is wondering if she's already on the estrogen patch, will using the face cream increase her overall estrogen?
No. So the facial estrogen and the vaginal estrogen, the facial estriol tretinoin cream and the vaginal estrogen are not absorbed systemically. So they can be used with the patch or the body cream or the pills, and that does not cause any issues.
Absolutely. And speaking of the face cream as well that we just started offering, Marie's just wondering, what is the name of that face cream?
So we actually had names that we were going to give it. Wonder Cream was the one I liked.
I like
and,
that.
Yeah. And then it was the Blossom cream. That was actually kind of an interesting story. So people had some names they wanted, and I'm like, I am like these kind of, risque names. Like, yeah, I don't feel comfortable calling it that. And so it was like this whole internal, like this guy, what are we going to call it? So we started asking patients, and one of our patients came up with Blossom cream. We're like, oh, we like that. The problem that we found with Blossom cream is that some people didn't really know what it was. And so we decided for the facial cream, we're just going to call it estriol with tretinoin cream facial cream. So people know what it is rather than come up with a catchy name. But I like Wonder Cream.
I like that. I mean, I feel like you can call it that internally. I like that. It has what its name, and then you can keep that. That's great.
Well, our original version, we were putting everything but the kitchen sink into it, and like, we're going to make a cream that's got everything, and it just didn't work well. And then we kind of ended up finding that this was like the perfect mix.
Absolutely. We have a question from Shanann, and she's wondering, should she be concerned if she's experiencing an increase in blood clots during her period?
You want to go on that one?
Yeah. So it kind of depends. I wouldn't be concerned that there's something dangerous going on, but if your periods are getting really heavy, that in and of itself isn't good because it can make you anemic. HRT really shouldn't make the periods heavier. For most people, at least after the first month or two, it tends to actually make them a little bit lighter, or it doesn't really change them much at all. But if you're finding your periods are really heavy and you're having like a bunch of clots, especially if they're big clots, you probably need to be seen. There may be something else going on. There may be a polyp or something, or fibroid that's causing that problem. It's probably not from the HRT, but if you're really bleeding a lot, that's not really healthy for you.
Absolutely. We have a question from Mima, and she's wondering, how can she persuade her OB-GYN that the benefits are way wider than just helping hot flashes? She said HRT has nothing to do with osteoporosis or cardiovascular health, is what her OB-GYN said.
Oh, yeah, I know Dr. Green's answer to this one. I know his answer. That's why we're here, to help you. So you can come to us.
We doctors are stubborn, and we're not. Yeah. You're not. If they think that this is what they feel, you're not going to be able to talk them out of it. And honestly, I just had this conversation with one of the Winona doctors. You know what? You're just not going to. Don't get into arguments with patients, and patients don't get into arguments with your doctor and start. Well, this study and this study. You're just not going to win that. Even if you're right, you're not going to win it. It's just not worth the aggravation. So now I'll tell you how you convince them. I had a patient, this was early on, I was going to Kaiser. Kaiser, for the most part, doesn't believe in HRT. And their doctor was refusing to give them HRT. They came to us. I wrote her for patches, what she wanted. And then 3-4 months later, she sends this really nice note saying, I so appreciate you. You like really helped. But now my doctor's seen how much this has helped me, and he's willing to write the HRT for me. And I'm like, that's great. Like another doctor educated. So that's the way you can probably convince your doctor, is they'll see the improvement and realize, well, hopefully, maybe I ought to relook at this. But finding literature and waving it at them and arguing with them, it's not gonna. It's not gonna.
You won't get anywhere. It's like arguing politics. You're not gonna change somebody's
you're never
mind.
Right. Religion and politics and HRT, I guess you should bring up parties.
Now Thanksgiving.
In polite company, right? I know at Thanksgiving, it's like there's so much diversity. Like we're not talking
Here's
about
the list. Here's the list we can't talk about.
We have a question from Christy, and she says, I just had an abnormal mammogram and have been trying the cream for about 7 days at 5 milligrams. Would that have caused that abnormal mammogram maybe that quickly?
No, 100%. Should not.
Yeah, 100% not.
But definitely follow up on your mammogram and make sure you have the ultrasound and all of that stuff. But if you're worried about it and you want to pause the cream, then that's not unreasonable.
Abnormal mammograms are very, very common, but I understand really, really scary.
Really scary.
Mammograms are set to not miss problems. So the idea with any screening exam, Pap smear mammograms, any of this stuff, is we'd much rather say, hey, there might be a problem, we need to take a closer look, and then it turns out there's no problem, than to miss a problem and tell you everything's okay. So it's the way these tests are set. And I can tell you, my wife and I, we went through this, and she had a call back on a mammogram. And I know as a doctor that it was going to be normal, but emotionally it still really scared me and my wife. And fortunately, it was a false alarm. So I understand kind of the angst when you get that call back. But most of the time, these end up being nothing. But definitely do whatever they recommend. And
they're sensitive, not specific.
Absolutely.
That's the medical word.
We have a question from a couple different people. Just wondering about, is there a best place on the body that has better absorption of the cream, or just where's the best place to apply that?
Oh, Dr. Green talked about this. So anywhere that doesn't have hair, not hair that's been shaven off, but anywhere that doesn't have hair follicles. So usually the inner forearm, the inner thigh, behind the knee, it absorbs within 30 minutes. And if you're concerned about your pets, if you missed it, we talked about pets and dogs getting enlarged nipples. So you missed a good time. But if you're concerned about that, the inner thighs is a good place, and it absorbs completely within 30 minutes. So you really shouldn't get a lot of transference to someone else unless it's your dog licking the medication off, which my dog would do, I guarantee.
So most people, with like the cool way to do it is to pump it directly on your inner forearm and then rub them together that way and get on your hand.
This should be the Winona symbol. Just this.
That's it. Yeah. That's the cool kids. That's the way the cool kids do it.
That should be the Winona, Winona. No, that would be bad. Okay, never mind.
Yeah, no, that's that looks like we're a hate group.
Yeah, that's not good. I take it back.
Oh no. Laura has a question. She says she's 42 and having most of the perimenopause symptoms. Is it correct that perimenopause can last 10 years? Is it safe to start HRT 10 years before menopause?
Oh, you go.
Okay, so the average woman in the United States goes through menopause at 51, but that's average. So there's lots of people that go earlier, lots of people go later. 15% of women complete menopause, not start going through it, but actually complete it at 45. So symptoms can start 7 to 10 years before that. So as early as 35, late 30s, it's not that unusual to be getting symptoms of the menopause transition. We're talking, 15%. That's about 1 in 6. So it's actually pretty common. 42 is a very common age to have these symptoms. The other thing, and we've touched on this before, is that there are health benefits that come from HRT. And the earlier they're started, the more health benefits you get. That's decrease in cardiovascular risk, decrease in osteoporosis, decreased risk of certain cancers. And those really are most beneficial if you start HRT at the beginning of the process rather than waiting until things are really far down the line. Doesn't mean you don't get benefit if, like, you put this off and you've been in menopause for a few years. You can still get good benefit, but you're really better off starting early. Isn't there like a Chinese proverb, the best time to plant a tree is 20 years ago and the second best is today, right? So, you want to start early, but if you haven't, it's still better to start today. But 42 is a very reasonable age for a lot of women to be starting HRT.
Absolutely.
And I just was reading, it said, do you have to change the application area? No, you can use the forearms every day.
Absolutely.
But I'm not going to keep doing this. We're done with that. But there is a really cool video of Dr. Green demonstrating. Is it you demonstrating?
I don't know if there's one of me. I don't know. I've made so many videos over the years, but yeah, I'm sure we've got one of those.
We're going to get one of those next of you, Dr. Green. That will be the next thing. We'll have to make sure I get one of those.
Check yourself out in the mirror and then applying.
Yeah, I don't really need more estrogen.
Fair enough. We have a question from Jennifer. And she says she's been on the cream for about 3 weeks and it's been a lifesaver so far. She says she does have some extreme breast tenderness and aching around her period, but it did subside after her period was over. She's hoping this will calm down over time, but I've also heard some conflicting reports that symptoms could cause breast cancer down the line, but other sources say that it doesn't. So can you speak a little bit to that?
You can get some breast tenderness when you first start estrogen, but that doesn't increase your risk of breast cancer just because you have the tenderness. And that, it sounds like it got better already. It should get better as you go along.
Absolutely.
We talked about this early on, but estrogen actually does not increase your risk of breast cancer. Progesterone increases it slightly, but the amount of increased risk is so small compared to the benefits you're getting from your decreased cardiovascular risk, et cetera, all those things that we mentioned, that women that start HRT that are appropriate candidates for it have a longer life expectancy and a healthier life than women that never take it. So big picture, I'm a big picture guy. The goal is to live a longer, healthier life. Eventually you're going to die of something. It's just kind of the way it is. You want to put that off as long as possible, and HRT helps you do that.
Absolutely. Angela is wondering, she says she's going through menopause and having some really bad episodes. She's had a partial tummy tuck before, and so she didn't have to used to worry about belly fat. But she's wondering about that's a thing now, and she's also wondering if this will help with hot flashes and night sweats. I think just wondering whether this is the right product for her in that sense.
Sounds like it. The belly
Sounds
fat.
like you're the poster child.
Yeah, the belly fat is like, that's a tough, but that takes time. That takes a long time. But yeah, hot flashes, night sweats, belly fat.
Absolutely.
Hop on the train.
And Angela, again, is wondering a little bit about how does kind of the process with Winona work? Does she have to go to her doctor to get it? What does that process kind of look like of getting signed up with Winona?
We are the doctor that will help you. We're like your hormone menopause specialist. So you come to us, you fill out the intake, you tell us what symptoms you're having, you tell us your full medical history, so we can make sure that you're an appropriate candidate. And then we will decide with you what medication treatment is best for you if you qualify. And then our pharmacy will ship the medications to you. And then we'll have automatic refills on your regular medications. And then we will do a 10-week follow-up with you to make sure everything is going well. But you can reach out anytime. It's called asynchronous telemedicine. So we're not live chatting like when you get on and you have an issue with your internet. So sometimes patients write, hello, are you there? We'll respond back. Hopefully it's happened. We'll respond back. Hopefully, that day. Hello, are you there? I'm like, well, not exactly. But we'll be back. We try and respond quickly within the day or the next day. And our patient services is really awesome. So I think that's one of the huge things you'll notice with Winona versus having to deal with your regular provider or even another telehealth company. Patient services they're all over it. So, things happen with the post office, things happen, and they are really good about addressing it and helping us with it. Because as the doctor, I don't always know the answer to the patient services side, but they know the answer.
Absolutely.
Let me say that you don't need to get permission from your doctor or get health screen from your doctor. We can take care of that for you. The other thing about Winona that's different than other companies is we only use board certified physicians. So you're really going to get, really the cream of the crop. Nothing wrong with nurse practitioners, nothing wrong with PAs. When I was in practice, I utilized them. They're great for what they do. But the complicated patients all got sent to me because I have the more training and the more experience and the more specialty. So we made a decision at Winona to use only board certified physicians. So that's what you're going to get. And the messaging thing works great because you wake up in the middle of the night, the hot flash, you're like, oh, what is that? And so you message me and then I get up in the morning and I see your message and I answer back. So it works really well that way, as opposed to trying to schedule an appointment. I don't know what it's like where you live. I know the last time my wife tried to make an appointment for a pap smear, it was like over 3 months waiting period before she'd get in to see her doctor. So you get in to see us immediately. I think it works really well. And I treat you as well as I treat my in-office patients, in some ways better, because they don't have the same access to me that you do. So you get really great care here. Now, can we take care of your cold symptoms? No, not really. I want to tell a funny story. The hello. So we had a programming thing that we didn't realize when we first started Winona. And so the messages come in order. So we take care of the oldest message first. It's kind of first come, first serve. So, and that's how we work down the messages in reverse chronological order. But what's happening, and it took us a while to figure it out, is that when somebody put a second message in, like, hello, are you there? It would bump them down to the bottom of the list. Some of these poor patients, they would write this thing, and then they would keep hello, and it just kept pushing them to the bottom, and they never got answered. And we couldn't figure out what was going on. And then we realized it's like, oh no, this is not good.
That's actually really funny.
Yeah, so it doesn't happen anymore. But it took a while to figure out what was going on. So anyway,
this has been, when you're chatting with your internet or Walmart customer service or whatever, and they ask you if you're still there or it disconnects, but we're not that live.
Right.
We're email live, not Walmart live.
Like that. There you go.
Like texting.
Yeah, we're texting live. Yeah.
That's great. Yeah. Wei has a question, and she's wondering, if I miss a dose or some doses, is that okay? What does that mean?
That's okay. The more consistently you take it, the better. But if you miss a dose or a couple doses, that's okay.
It can trigger bleeding. So it'll punish you. It's not dangerous, but it's annoying and it'll punish you. So eventually you kind of learn. But yeah, it can. That's kind of the one thing that'll happen.
Absolutely. We have a question from Martha, who says, she says, if you had a partial hysterectomy, does this immediately or automatically put you into postmenopause? I had a hysterectomy at age 33 and was never told I should get on any kind of HRT or any knowledge of when our ovaries finally stop working after a partial hysterectomy.
Okay, so partial hysterectomy, which always makes me giggle because it's not part of your uterus. I just think it's a funny term.
Well, it's not the right medical term. That's the problem.
Right, I know. So technically, partial hysterectomy would mean part of your uterus. But if you had a hysterectomy, just your uterus removed, that does not affect your hormones. The ovaries are what release hormones. So an oophorectomy would be your ovaries removed. So if you have both ovaries removed, then you're in surgical menopause. If you have one ovary removed and the other ovary is still functioning, then you're in, then you're not in menopause. Once you have your uterus removed, it can be a little bit harder to tell because you can't base it on periods, but you can still base it on symptoms. But having the uterus removed does not affect the hormones because you still have the ovaries releasing the hormones.
That is the absolute right answer on the test. However, no, you're right. And that's the right answer as the absolute right answer. But women that have had hysterectomies, even if they leave their ovaries in, there is some blood flow disruption. And so there is some data that they tend to go through menopause earlier than they would have if they still had their uterus. The party line is leaving the ovaries in, even just one ovary does not affect the menopause transition. And that's mostly true. But there is this thing where there is some differences in blood flow, and so it can put people in menopause a little bit earlier. But what you said is absolutely correct. But I just want to kind of throw that out there because, and honestly, the tubal ligations can do the same thing. There's no reason a tubal ligation should affect your hormones, but it does seem to kind of affect some of the blood flow to the ovary. And so I've noticed that it can, for some women, it can kind of change their hormonal milieu, so to speak. It's kind of interesting. But that's not the right answer on the test. So if I was taking my board exam, that's not the way I would answer it.
I'm always taking my board exam. It's a daily.
Tina is wondering, in reference to the Blossom cream, is the expiration date really a month if it hasn't been used?
even if it has been used. So the way compounding medicine works is the default is 1 month. In order to get more than that, you actually have to do studies and prove that it's good for longer. So if anything that hasn't had these studies, you have to slap a month on there. But for one thing, it's not dangerous to use it beyond the 1 month date. And my experience is it still works. But legally, that's what we have to put on the bottle. So yes, the official answer is yes, at 1 month it blows up and it can't use it. But the truth is, it's not going to be dangerous, and it's probably still going to be very effective.
Absolutely. Rose is wondering, she says, I'm on the lowest dose estrogen patch and the lowest dose of progesterone. I've been having anxiety for the past few months and wonder if I should up my dose of either of these.
I think it's probably worth a try, especially if you're on the lowest dose estrogen patch and your anxiety seems to be related to perimenopause. If there's something specific going on in your life that is causing anxiety, then certainly addressing that. But yeah, if you feel like you didn't have much anxiety before perimenopause and then started having more anxiety, then yes, absolutely. And we like to start low with hormone replacement therapy. Doctors in general like to start low with everything because, as you know, with lots of things, some people don't experience anything and some people have the worst side effects in the world. So we always try to start low and then go up. And if you're on the 0.025, then you have a lot of room to go up on the estrogen.
Absolutely. We have a question from Devin who says, will the topical skin creams help urinary issues like frequent UTIs and yeast infections?
The facial cream will not. The systemic body cream will. I'm not sure which. I assume they mean will the body cream. Any systemic estrogen will help, should help with some urinary issues, should help with vaginal elasticity. Not as much as the vaginal estrogen cream, but some. What was the other thing?
It was with frequent UTIs and yeast infections.
Well, it'll help with the health of the vaginal tissue, so it should help with both of those things.
Absolutely. We have another question that says, I've been on the progesterone and estrogen cream for 2 weeks. Can I use it every other night, or do you suggest every night?
It's probably better to use it every night. If you're concerned about side effects, then you can ask your Winona physician, and they may tell you to use 1 pump of the cream instead of 2. But 1 pump every day is better than 2 pumps every other day, because otherwise you're getting a lot of fluctuation. But check with your Winona doctor. Don't tell them that I said that you could do that. Listen.
Maybe you're their Winona. Yeah, they may be your patient.
Oh, if they're my patient, then we've already talked about it. Probably.
There you go.
But
I love that.
I had a patient in residency that told another doctor that I said, if their hemoglobin was below a certain number, that they needed a blood transfusion. And it was a number that, it was like a high number. And that person said, is that what you said? And I was like, no, that's not what I said. So that's why I say, don't quote me. Ask your personal doctor. Ask your Winona doctor what they recommend. But daily is generally better than every other day, because then you're going to have a lot of fluctuations.
Absolutely. It looks like we have a couple questions along these lines. I think we touched on this a little bit at the last Q&A, but just to kind of cover a few of these, there's a number of people wondering, just talking about the facial cream, if we're ever going to kind of expand that line, maybe go into an SPF cream or some other creams to use along with that, and where that might be headed.
So there's been a lot of discussion about bringing out other products. Not sure what I should leak. But what's that? You're listening. There may be something for your hair coming down the pipe.
Okay.
So because that seems to be a big need for our patients. So that's kind of the thing we're looking at right now. And we're actively pursuing that. Hopefully Q1, you're going to see some new products coming out. But we're really careful. So The facial cream, the first conversation about the facial cream was actually before we launched. So that means it was 4 years ago. So this has been a long time in the making, because we don't want to just throw stuff out there. We want to make sure it works. It's great. It's like really high quality. And I said this before, we went through a lot of iterations, and a lot of our staff and my wife and other people's significant others and were guinea pigs as we tried to figure out what was the best thing for our patients. So, but there should be more stuff coming. I think Q1 we're going to have a new product, hopefully.
That's so exciting to hear. And I know I saw a few heart eye reactions about that from the chat. So it looks like some other people are feeling the same way about that. Looks like we've got one more question from Annette. She says, I live part of the year in Nevada and part of the year in Oregon. Is that a problem having two addresses to ship to?
Those two are fine. So we're in most of the country. There's a few states that are unfriendly to the type of telehealth we do that we just, we've got to follow the laws, obviously. But Nevada and Oregon is fine. So, but you want to make sure that you talk to customer service, to patient services well in advance so that we make sure we ship it to the right place. We don't let people change their state address on their own. You need patient services help with that because we want to make sure it's a state that we can ship to. But Nevada and Oregon is fine, so you're in good shape.
Absolutely. But you may have to, if you move, you may have a different doctor.
Good to know.
You have to be licensed in that state.
Correct.
Looks like we have a question from Lori who says she's been on the DHEA and cream for about 3 weeks. If she hasn't seen changes in her body or kind of in her symptoms yet, should she contact her doctor?
Well, you can contact us anytime. That's part of the beauty of us being available for you. But for a lot of patients, it takes 6 to 8 weeks to really start feeling better, to have those changes in hormone levels. Some patients write back. I've literally had one today that said 3 days later, she felt awesome already. And then some patients, it really does take 6 to 8 weeks. So you can write if you're not sure. That's always welcome, but I would give it more time.
Absolutely. And it looks like we have a question over here from Heidi. And she says, I used to take the DHEA in the morning and recently started taking it at night. I noticed that I sleep so much better now. What might be the reason for this?
Everybody responds differently to these medications. Particularly the DHEA. I found that for most people, it kind of doesn't matter what time of day. For those that do, usually morning's better, but every now and then you have somebody just like you where it helps them at night. The why is really hard to answer for some of these things, honestly. And honestly, it's not really important. What's important is that you figured out what works for you, and that's great. So, stick with it. If that's what's helping, that's totally great. And I'm glad you found a way that's beneficial for you.
I'm going to start quoting Ted Lasso. All people are different people. Ted Lasso's got a lot of good quotes.
That's a good one. Absolutely.
All people are different people.
Absolutely. Judith has a great question, and she says that this last month she feels like she's been drinking from a fire hose of information, which, first of all, it's a great sentence that she wrote this there. But she says, up until then, I feel like I was really dismissive of all symptoms, and now I feel like I skipped some basic women's health classes that she doesn't really realize no. As she continues to learn, do you have any recommendations on the perimenopausal journey, and where can she find more information to learn about that on?
We have really great articles on our website that I edit. They're really, really good, and they're written in everyday vernacular, so they're not too hard to understand. So if you go to our website, there's discussions on all of the things that we've discussed today. Actually, there's articles on there that are medically reviewed. And Google can be a really scary place. I always like looking at, I'm family medicine trained, so I always like going to the American Academy of Family Physicians because that's peer reviewed. I assume Dr. Green will say ACOG is a good place to go and look. Yes,
not necessarily.
No? Okay, not necessarily. I like
First of all, ACOG is closed, so you can't get into the good stuff
Okay.
if you're not a member. Yeah, the AFP is a good site. I honestly, go to our journal section. We've got hundreds of articles that are referenced with real references. That's one of the things that I kind of insist on. They're edited and for scientific validity by true experts like Dr. Perman. Don't go, like the Mayo Clinic site, the Cleveland Clinic site, those are all AI written. So I know that for a fact. Our sites, we have medical writers that we hire. We have a whole medical writing team. We have an editorial team. That's one of the things that we really feel strongly about. We're not just a company that sells you HRT. We're really an educational company. I've always felt very strongly that my job as a physician is not to tell you what to do. My job as a physician is to educate you and explain in a way that you can understand what's going on with your body, various options that you have to make it better so that you can make a good decision about what's right for you. But you can't make that decision if you're not well educated. So, that's why we do this, right? Is to answer your questions and educate you. We spend a lot of our resources on educational material on our site that's really well done. That's all originally done, not AI written. So I think it's very important. The more you know about your body, the better decisions you can make about your own health.
But the fact that you're asking that and you know that there's a lot of mixed information out there is really good. That's the first step, is knowing that not everything you read is peer reviewed. Seriously, I mean, there's a lot of scary stuff on the internet. And people just write things, you can just write whatever you want on the internet.
Very true.
Call yourself an expert. Yeah.
There you
That's
go.
right.
Miranda has a question, and she says she's just beginning perimenopause, and she's been experiencing a major increase in anxiety, and often this feels related to her cycle, and it has this at certain times during her cycle. And can HRT help with this?
Yes, it can. And we talked a little bit about PMDD earlier. So for some patients, they might have some premenstrual symptoms the week before their period. And so your Winona physician may recommend increasing to 3 pumps of the cream the week before your period. But yes, it should help with those symptoms. There are some patients that when they take DHEA, they have some increase in anxiety or irritability with the DHEA. So that's something to keep an eye on as well. But that shouldn't be a huge issue because we start with a low dose of DHEA.
We have a question from Steph who says, I feel like my eyesight has improved on the cream for 10 weeks now. Is that actually possible?
Why not? Sure.
I like that.
I mean, it improves joint health. And I mean, you may have some improved, inflammatory marker stuff. We'll take it.
Yeah.
If it makes you richer, we'll really take it. That's what I want.
By the way, do you know why people think carrots make your eyesight better?
Something about beta carotene.
Supposedly, this was something in World War II that the English were perpetuating.
Oh, interesting.
As a cover for breaking the German codes. It was like, oh no, it's just that our guys eat so many carrots that they can see all this stuff. It's probably an urban legend, but that goes around quite a bit.
I love that. And then on the opposite side, a little bit of the eyesight improving, Mari says she feels like she gets terrible gas after she takes DHEA and the 50/50 cream. Is this a normal side effect?
There can be some bloating. It usually goes away after a little bit. It has to do with the hormone effect on the slowing of the GI system, which can cause some increased gas. It's usually something that goes away after a few weeks or a month or so. Gas X is okay to take. That can help, but it's usually a temporary side effect if it happens.
Absolutely. And we have one from Martha that says, I'm having a vaginal irritation lately. I just got my regimen today and we'll start it tonight. Should I also get a vaginal cream? If so, I get confused what kind of cream as I hear about the estrogen cream versus the progesterone cream.
So the systemic body estrogen cream with or without progesterone can help with your vaginal symptoms, so it's worth giving that a try. We offer a vaginal estrogen cream as well, which is applied to the vaginal area, which specifically helps with vaginal issues, which you can use along with your systemic treatment. We don't use vaginal progesterone cream or vaginal progesterone at Winona.
Absolutely.
And the reason is, I mean, same thing, vaginal progesterone cream can help a little bit. DHEA cream, there's actually, there are some studies that vaginal DHEA cream can help, but none of them help as well as estrogen. So if you're going to use a cream, you might as well use the one that works the best. Why mess around with something that doesn't work as well? And it's not getting absorbed systemically, so you don't have to worry about that. And so that's why we use the vaginal estrogen cream, because it's the gold standard. It's the one that works the best.
But don't put the systemic estrogen cream in the vaginal area.
Yeah, that's not intended
for
that.
On your face. Don't put the systemic on your face.
Yeah, please.
It's a reasonable thought.
We do have a question from Lorraine, which is a two-part question. But the first part is DHEA just safe to take? And then the second is it safe to take with estrogen? And if so, can they be used at the same time or of the day, or do they need to be split up?
Yes, and yes. They can be. DHEA is safe to use, especially in low doses. We get a lot of questions about whether you can take DHEA with your SSRI. That's a question we see a fair bit. At the lower doses of DHEA, it's not a problem at all. It's the high doses of DHEA. So we have a lot of patients that are on Prozac or Paxil or Zoloft and take DHEA, and that's no problem. DHEA and estrogen work well together, and you can take them at the same time if you want. Estrogen and testosterone are naturally occurring hormones in your body, and they work together well, so they're used to each other.
Absolutely.
The issue is on the internet, there's a lot of scary stuff about DHEA, and the reason is DHEA is a performance-enhancing drug. In really high doses, it gets the testosterone really up there. So it's for these like big bodybuilders that are using, really pushing their testosterone. Part of the stack, so to speak, is these giant doses of DHEA. And in that kind, 200, 400 milligrams a day, whereas we're prescribing 25 to 50 milligrams a day. So in those giant doses, yeah, it can cause a lot of problems and a lot of side effects. And in fact, the bodybuilders will use these like 400 milligrams of DHEA a day, and then they use something called an estriol to block the estrogen component. So yeah, in those big old doses, yeah, it will cause problems. And that's where you see on the internet where people tell you that DHEA is dangerous and it causes all these problems. It can in mega doses, but not at 25 to 50 milligrams.
No, answer this one, because people have asked this about testing. If you take DHEA 25 milligrams and you have to do drug testing.
Yeah, if you're in a sport that tests and DHEA is on the ban list, you should not be using DHEA. It'd just be a bummer if that got you disqualified. So I think it's unlikely to come up positive, but why risk it? I do have some athletes that are competitive athletes that that we talk. In fact, one of them was funny. She's like, "Okay, I'm not competing anymore. Can I have my DHEA?" So, but if you're competing, why take the risk? I wouldn't use it.
Absolutely. And I know we slightly touched on this question already, but I've just seen a few more since then. So I think we've had a few more people. But just wondering about if they're seeing a little bit of weight, whether that's water weight or bloating, kind of show up right when they're starting HRT. Is that normal? How long will it go away? How long will it take to go away in that?
Yes, that is common. We see that in the first month or so, and it should resolve over the first couple of months. But you can always check with us about it if you're concerned about it. But it shouldn't cause like weight gain in terms of like, you shouldn't be, it might cause bloating, but you shouldn't have a significant amount of weight gain, unless you're changing your dietary or exercise habits.
Absolutely. And we have a question from Stacy that says, what if we cannot tolerate oral progesterone? Should we be concerned that the topical doesn't absorb enough to protect the uterus?
Ooh, Dr. Green did this one. This is Dr. Green's favorite one. Go. He loves it.
Yeah, so we did this early on, but progesterone's a big molecule, and so it doesn't absorb as well through the skin as estrogen, but it still absorbs okay if it's done correctly. So the problem with progesterone creams is that you have to do it right and you have to do it well, which we do. But if you're just nilly-willy giving someone progesterone cream, or if you're buying an over-the-counter progesterone cream, which really doesn't have any significant amount of progesterone in it, it's not going to be enough to protect your uterus. When dosed correctly and the right kind of progesterone is used, like we do at Winona, it's very, very safe and absolutely works for uterine protection, which is really the reason. So when done correctly, if you're at Winona, our progesterone creams are going to protect you. But don't just buy a progesterone cream off Amazon. You're going to end up with a problem that way, because that's not going to work. But yes, if done correctly by a good compounding pharmacy that's dosing it correctly, then it's absolutely adequate and works well as the orals.
Absolutely. And it looks like this is our last question of the night, but Kelly is wondering, how does Winona compare in price to other HRT providers?
Oh, that's a big dog question. That's you. Big dog.
So we are priced competitively. I'm sure we're not the cheapest. We are the best, but we're not the most expensive either. We're also very transparent. This is something I feel very strongly about. I hate getting surprised where somebody promised me something. Oh, and by the way, there's this extra thing we're going to charge you. So some of our competitors charge this platform fee, where they charge you a monthly fee on top of what they charge you for the medicine. So it makes the medicine look cheap, but what you don't know is you're also paying $100 a month just to have the opportunity to use their program. So we roll everything into one price, so it's just totally transparent. This is what it costs. So there aren't surprises. Oh, by the way, you owe us this as well. We try to pass our savings along. So I said earlier, the cream, we have our own compounding pharmacy. We make the creams ourselves. We compound it ourselves in our own pharmacy. That keeps prices really down. And so we are able to provide a really, really high quality compounded cream at a really reasonable price. I think much better than you're going to find at your neighborhood compounding pharmacy. And we are the biggest provider of compounded HRT in the country. So we do it really well. When you do it at scale, you can do it right. And that also keeps prices down. We also
patient services. You're paying also for our patient services, which is second to none.
Yeah, but our prices are very competitive. We also I heard that we are actually the biggest utilizer of patches in the country as a single entity. I don't know if that's really true, but that's what I was told. But anyway, the point is that we buy at scale, which keeps our costs down that we pass on to you. So it's also cheaper, for instance, to get a 3-month supply because we don't have to ship it to you every month. So that keeps our costs down. We pass that along to you. That saves you about 15%. So I think if you actually compare apples to apples, and our prices are very competitive, and I think they're on the lower end, but they're also very transparent. So it may look higher until you find out that these other places are nickel and diming you for a bunch of other stuff. And we just try and make it simple for you.
Absolutely. Well, thank you.
But, we are a business, so, yeah, we're going to make profit, but, we don't have to make all our profit off of you. So the idea is that when you're big, you can make a small amount of profit on lots of people and keep your costs down that way, and still be we're not a charitable organization, so I will say that, and that's obvious, but it's a scale issue. So it's like Costco is going to give you a better price than your local little mom and pop place because they're doing things at scale, and we have that same advantage.
Absolutely. Awesome.
And apologies to anybody's name we butchered tonight because I lost my internet. Oh.
No, you're there.
Sorry, we can see you.
We can see you.
Okay,
We can hear you.
well, apologies to anybody's name we butchered. As somebody with a 38-year history of having a name butchered, apologies if your name was messed up. I get it.
Yes, and thank you so much,
For
all of
real.
you that were able to come tonight for spending this time with us. I know that we love doing these, and it's so fun. And it looks like Dr. Perman has jumped out, but thank you all so much for coming. And Dr. Green, thank you so much for your time. I feel like I learn a lot so much on every single one of these. And so I love coming to these, and I know that the audience loves it as well. So thank you so much for sharing all your amazing expertise with us.
Well, thank you for thank you for the great moderation, and all y'all out there, thank you for the great questions. Because without that, these are really boring. And then it's uncomfortable. It's like, what are we talking about?
Yes, you all are the lifeblood for sure with the questions.
That's right. And don't hesitate to ask us in the portal. So you don't have to wait once a month to ask questions. You can ask your Winona doctor. We're very available for you.
Absolutely. Awesome. Well, thank you all so much. I hope everyone has a great evening or morning or afternoon, whatever time it is that you're tuning in. So thanks again. Thanks, Dr. Green, and I hope everyone has a great night.
See you next month.
Bye-bye.
Bye.